Well, welcome students. This is Module 10 and we're going to be talking about adolescent sexual behavior. I wanted to give you just a few things to think about as you read the text. Remember, we're talking about sexual activity and sexuality in adolescence and emerging adulthood. Arnett brings in those young adults between 20 and 25. So consider the comparison between early adolescence and emerging adulthood or later adolescence. Steinberg's theory of love in adolescence, I want you to take a look at that. Cultural standards with regards to sex before marriage. What does the research say about the likelihood of long-term relationships if there's involvement in sexual behavior before marriage? Sexual scripts for males and females, there is a difference on what's accepted. I want you to look at global aspects of that. What do other cultures say about sexual behaviors between males and females in comparison to American adolescents and American social norms? Sexuality among gay, lesbian, and bisexual adolescents. What are some of the challenges they face with their sense of self and identity and how others perceive them, whether they're going to accept this level of identity as a part of themselves or something that someone else is imparting upon them? Problems in adolescence. What about adolescent sexual behavior around the whole concept of immortality? We know young people have this sense of, I'm okay, I'm going to live forever, and they don't really take into consideration the challenges or the risks associated with their behavior. So we're going to look at things like contraception, pregnancy, abortion, parenthood. Are young people, as they develop, and Piaget talks about cognitive development, are they really mature enough cognitively to take on the responsibilities of parenthood? What about the decision to have an abortion? What about the behavior before you have to make that decision to have an abortion? Thinking about choices and consequences. Do adolescents do a very good job of making decisions before they react on their emotions or their feelings? Sexually transmitted infections and treatment. I actually uploaded a link, an podcast from NPR, the National Public Radio station, discussing a new drug that's supposed to prevent HIV. And the conversation that came up, I want you to listen to it. I'm going to give you a little bit of a usurp, but it just talked about this question. Is it in adolescents' best interest to take this drug? And what does it have to do with their sense of immortality? I want you to think about that and then make a comparison. And then sex and education programs. Are there programs that are going on in the schools or in the community and society that are really effective? And if they are or are not, what do you have in mind that might make those programs more effective? I really want you to think about this as we have our Zoom meeting this week. Yes, we're going to talk about these things. One of the things I want you to think about is the rate of HIV and AIDS among young people. And you'll find in your Arnett slide, I think it's slide number 50, I want you to look at what's the percentage of HIV among young people in African countries. Then I want you to think about, do a little research. What's the rate of HIV among adolescents in America in comparison to Africa? Okay, we know that a percentage of 15 to 25-year-olds living with AIDS in African countries has increased. When we talk about sex education, one of the things we know that Americans agree that rates of premarital pregnancy and STDs in adolescents are serious problems. What are your thoughts about that? There are some disagreements, however, about the best solution. One side says we need to do comprehensive sexuality education. The other side says, no, we need to teach about abstinence. And so the question is, what do you think is the better solution to the problem of teen pregnancy and sexually transmitted diseases? You know, there's a conversation around sexual behavior that a lot of people, particularly in America, it's a taboo to talk about issues around pornography. I want you to think about this quote. I'm not going to say I've never watched porn. I mean, what can you do? It's part of life. If you're going to look at it and you're going to watch it, that's your decision, I guess. I don't watch it on a regular basis, every now and then, of course, but it doesn't affect me. I want you to think about And consider in your discussion board research finding presented in the text related to rates of pornography used among different groups, addressed and how they address that, reasons for pornography use, effects of pornography use. And that's the one I really want you to think about. What are the effects of pornography use? These are conversations young people don't necessarily want to have. They're having it among themselves. They're not going to have it with you. But maybe these are some of the questions you want to present to them as you prepare for your final project, which is an interview with an adolescent. There are 10 characteristics of effective programs. They focus narrowly on reducing one or more sexual behaviors. That's this whole abstinence and reduction. It's a reduction theory. Base the program on theoretical approaches of other risk factors. These also give a clear message about sexual activity and contraceptive use. Those are the effective programs that help young people move forward in making good decisions. They also provide basic, accurate information about risks and methods. Okay, if you're going to engage in it, at least be safe. Include activities that teach how to deal with the social pressures. A lot of young people don't necessarily want to be involved in sexual behavior, but they think it's the socially acceptable things to do. And I'm going to move forward. You're going to read about all 10 characteristics, but finally, think about training teachers how to interact with youth. That's important as you move towards your professional trajectory. So think about these key ideas from this chapter. Romantic relationships, when we're talking about the chapter that Arnett wrote, and I want you to compare it to McWhirter's chapter 9 as well. Romantic relationships tend to begin with mixed groups, right? Young people tend to hang out with groups of people, and then eventually they become more engaged in one or two other people that they really are more intimate with, and then they find that one person that they feel like they're very much in love with. But we realize that it's infatuation more so than romantic love. When we talk about emergent adulthood, then they have a little bit more of a different perspective or rationale. I want you to think about the comparison of non-Western cultures. What is expected of young people in interactions? What about the issues around marriage and family issues rather than individual choice? Okay. Let's talk about, with respect to views on adolescent sexuality and cultures, how about those three areas of progression between more conservative cultures and more permissive cultures, if you will, from restrictive to semi-restrictive and permissive? My question to you is, where do you think America fits in? Is America more of a restrictive mindset, a semi-restrictive, or permissive? And I think there has been some changes. We talk about the chrono system. Changes over time. You should be able to speak to what changes in mentality or social norms has happened over time. Okay, well, I've given you some really good things to think about. This should perk your interest in wanting to read Arnett and McWhirter chapter 9. And I want you to be able to come. If you can participate in the zoom.com, that's great. If you can participate by phone, by computer, you can chat, you can type in some questions you want me to cover, and perhaps I'll put some of those results in the announcement or in this week's discussion board as a response to you. Okay? Have a great week. Talk to you soon.